I was reporting on a Toronto public health investigation back in March about letters that were sent to 2,500 patients warning that they might have been exposed to Hep B, Hep C, and HIV at a Toronto OBGYN's clinic. As part of my reporting, I was speaking to patients who received these letters. That led me to other women, former patients of Dr. Esther Park, who said that they had had traumatic experiences with the same physician that dated back almost a decade ago. Their allegations included inappropriate treatment. Marie-Louise is one of the women that I spoke to. She said that back in 2018, Dr. Esther Park did a vaginal exam on her that she did not consent to while she was asleep at the hospital. She was there giving birth to her second child. She's one of the 6 patients that I spoke to who said that they wanted to tell their stories.
When I read Dr. Park's name, everything just kind of stood still, and I was just like, okay, all right. If there was ever a moment to talk about this and to get it out there and to get it off my chest, now would be the time. I think there was a release in seeing, it wasn't just me, other people have been impacted by this person, and it kind of allowed me to sort of say, okay, you know what? This isn't a personal failure of mine. This isn't something I did. This isn't something this is part of a systemic issue. This is part of something that a lot of women have experienced, obviously a little bit different than me, but it allowed me to kind of tap into those feelings and let them go. So it's been cathartic in a way.
Another patient I spoke to was Alejandra. She said that Dr. Park did a procedure on her called an episiotomy that she did not inform her about adequately. She also alleges that she did not receive adequate care after the procedure.
I felt like I didn't really have a voice. It just felt way too fast, way too rushed, and when it came down to the birth, it was very traumatic. And I think it's extremely important for women to advocate for themselves, whether you're pregnant, whether you have a cold, whether you feel pain. Doesn't matter. We need to speak up. We need to speak louder. I think there needs to be a lot more support when it comes to women's health. There also needs to be consequences when that medical care fails us.